Real quick, I was just driving and I was thinking about nurses, right? And there's a special group of nurses called travel nurses, right? Travel nurses are based in their hometown, but they spend probably like 80-90% of the year traveling around the country, taking care of hospitals and patients away from home, right? Man, I know it may seem glamorous, right? Like they get to stay in hotels, they need to go see different areas, go to different states, but think about it. These nurses that travel are away from their friends and their family 80-90% of the time. And I know people say like, well, they choosing to do that, but sometimes financially you have to do what you got to do to survive. To every travel nurse out there that feels overlooked, that feels unseen, that feels uncared about, that feels like they are just a number in another hospital, in another hotel room, and they're not appreciated, I see you. I appreciate you, because I am pretty sure at a time or another, I've been in the hospital, or my children have been in the hospital, or friends or loved ones have been in hospitals, and a travel nurse saw about them. And then one of the more difficult things is you get a travel nurse that travels to a city and creates connections with that staff and certain patients. And then at the end of their 3 weeks, 4 weeks, 6 weeks, whatever their contract is, they got to leave and go back home. And then they got to reacclimate, if that's the correct word, to a hospital that they started out, but they are not familiar with anymore because they spend most of their time traveling the country. I understand that you guys may get frustrated. I understand that you men and women may get lonely. You may get tired. You may feel unheard. You may feel unseen. I understand the perception from the public that you may get paid a little bit more, so you should shut up and be happy. But the job you are doing is exceptional, and we appreciate you. And if nobody cares, Josh Prey and Tupac cares. Being dead serious. Because I couldn't imagine just being away from my kids or my spouse or my friends and my family and not being able to just like go hug them after having a long day. And travel nurses typically work the longer shifts because they are brought in to cover the nurses or medical healthcare workers that are there already. So if I'm in a town and I need a day off, that travel nurse or travel person, whatever the correct terminology is, gotta cover my shift. When the pandemic hit, everybody became a travel nurse, meaning everybody was relocated. Everybody had to go help somewhere. In desolate areas, in poor areas, in areas where there was only 15, 20 people in that building. So today I was driving this morning and I just thought about all the healthcare professionals and everybody that's done a great job, and everybody that's put their life on the line, and everybody that's probably suffering from exhaustion and mental exhaustion, physical exhaustion, and they're feeling emotional and they feeling like nobody cares, nobody sees them, and all they want to do as an adult is go home. And they are weeks away from going home because they committed to something, they signed a contract, and they have to do it. If you are related to, if you are a travel nurse, if you are friends with a travel nurse, I want to say thank you. We love you. We appreciate you. And we definitely see you.